Hey everyone, my name is Rose Medina and this is my presentation. I chose oncology and I didn't choose a specific form of cancer to focus on in this presentation. I just chose to talk about oncology and cancer as a whole. So, quick overview. Cancer is when cells in the body divide and attack parts of the tissue that become uncontrollable. So there are 100 types of cancers that have been discovered, and cancer is the second leading cause of death in the United States. There is no known or specific cause of cancer, we just have risk factors. So those include poor eating habits, obesity, smoking, drinking, age, family history, social circumstances, and the environment. Some common treatment suggestions are chemotherapy and radiation. So, how is working with cancer patients different from others? So, I believe what differentiates this population from others is just the word in and of itself, cancer. It's scary, it's feared. When we think of cancer, we think of death. Um, and we know that there is no cure for cancer. Therefore, that we start to believe that this is the end, which is sad and it's scary, but that's the truth. And so, therefore, I think that's what separates this population from any other. When you talk about mental health, for example, depression, we know that there are medications to reduce depressive symptoms. We know that there are coping skills, therapy. There's so many other types of ways that someone can overcome their depression. And unfortunately, that's not the case for cancer. And so that's what I think separates it and just the wide range of people who are affected. So, young kids to elderly, all walks of life. And unfortunately, men, 44%, are at a greater risk of developing cancer than women, 38%. So there are a lot of challenges when you're talking about cancer as a whole, but these two I chose to focus on um, just because I thought they were most important in my research and everything I was reading. So again, like I said, there's no cure for cancer, although we've made a lot of strides in research and we have reduced the number of deaths involving cancer, there is still no cure. And although cancer, you can be in remission and not there not be any signs of cancer, it still can come back. So that's what makes it again scary. Second, the second challenge I chose to focus on was stress. So there are layers and layers of stress that the patient is experiencing and their loved ones, from just daily stress of not knowing what's going to happen, the terminology that the doctors and nurses are using, so just the lack of knowledge in general, not to mention, kids, financial stress and maybe having to quit your job or go into long-term disability. All those are layers and layers of stress that can be really detrimental to the health for the patient. So, although I think stress plays a huge factor, there is a weak connection when it comes to stress being a cause of cancer. There is no research or findings that stress causes cancer, but it does play a big role. So the National Cancer Institute did a study and with mice, and so they've transplanted some tumors in certain parts of the body, and they had a group of mice that were under stress and a group of mice that were not under stress. And they found that the mice that were under stress had a greater or increased chance of the cancer spreading to their lungs and lymph nodes than the other mice that were not under stress. So, Although some research says that this is a weak connection, I do believe that this plays a huge part, and that later on we might find out in more research that stress is one of the causes of cancer. Um, but right now, I thought that was really interesting, and I think it's really a segue to what's to come in the findings in the future. So, addressing these challenges. So, number one, you know, again, trying to find a cure for cancer. Um, Really, what I would do is just try and link up with leading researchers. I would try to use my background knowledge of trauma and psychology, social work, and really try and strengthen the connection between the mind and the body as far as what is causing cancer and how we can use our mind to even get rid of cancer. So I know it seems far fetched, but I do believe the mind is powerful, and that there can be some stronger connections there in the future. And so that's what I would help and put my time towards as a social worker to address that challenge or need. Second, just would be really having a full scope of crisis theory. Um, like I said, this might be my first encounter with a patient. They come into the emergency room and they are stressed and they are in crisis. So, therefore, I would need to really fully immerse myself in crisis theory and all that it entails so that I can help the patient to reduce their level of stress from the get go, and then we can move forward from there. Really, it's about creating a culture of survivorship versus preparing for death. In my week 5 article, um, I discuss how mental health treatment in patients that had cancer saw a reduction in their depression and anxiety. So, that being said, I talked about how those that asked for help really saw overall better mental health. And I asked the class why they thought women were more found in the study to be reaching out for help um, as opposed to men. One of my classmates suggested that there was overrepresentation of women in the study as opposed to men, which I believe is true, but in general, we know that men are diagnosed with cancer more than women. So it is interesting to see how in this study women asked for that mental health treatment. So maybe it's a societal problem. Maybe we place men in a category where they don't really discuss their problems or issues and they deal with them differently. And women are um, more likely to discuss their problems than men are. So I would just still like to challenge the class to think about what that really means and looks like. And then, as far as environmental factors, the study was done in the Netherlands. So, how can we take those findings and apply that to the US and our culture, knowing that environmental factors play a huge part in, being diagnosed with cancer? So, going forward, how can I distinguish myself from others in the field? So, when working with this population, again, we think of cancer, we think of no cure, we think of death, we think of stress, scary, and financial stress, and so many sorts of things that I already discussed. So, what I would do would basically be kind of flipping the script. I would focus on all the positive things. I would focus on a strength based perspective, finding the client's strengths. I would help them understand that there are thousands of people that have survived cancer that have used this for the greater good. And I would really just try and focus on positivity, going forward, living life to the fullest. I would not be the social worker that's like, hey, is your will up to date? I would be like, hey, we can fight this. I'm here for you. Be supportive of the family member, and just creating a different culture around where they're at, and just associate how they're associating the word cancer and what they're dealing with. So that's what I would do. I would also um, come up with an assessment. This would be help me and the patient. We would be able to measure their level of stress. And how I would do this would be from the beginning, middle to end. And this would allow me to fully understand what they're stressed about, from, the top to the bottom. That way I can link them with better resources and really understand where they're coming from instead of just assuming. So what resources would you need as a social worker? First, I would just need to educate myself fully on crisis theory. That way I can better assist the patient as soon as they come into the door. I would need to create my stress assessment and fine tune that to be able to measure and collect data from their level of stress. I would just need to be able to train, talk to, communicate with other therapists, doctors, and nurses on how to complete this assessment, and just continue that positive demeanor and aura for the patient, so we can create a consistency amongst the team and the staff, and trying to help the patient as much as possible. What resources would the patients need? They would just need interventions, one-on-one family therapy, especially if there's other mental health concerns prevalent, such as depression, anxiety. So just keeping up with that, making sure they have the proper coping skills, and just educating them on the proper treatment as far as what they believe in their culture, what they need to abide by their belief system, and then just really link them with community resources as far as financial support, family support, childcare, all that sort of thing. And my question for the class: do you believe the brain is so powerful that it can heal the body? So getting rid of cancer or keeping cancer away. And here are my references, and that's it. Thanks for watching. I look forward to watching all of your presentations and learning from you guys.